Hi everyone, welcome to our presentation. My name is Alejandra Enriquez and I'm here with my classmate Maria Lopez. We are both students of the Speech Language Pathology Master's Program at Tutelas, and this project is part of our English Module 2026, guided by our teacher, Professor Cynthia Valdez. Finding the Words, a Guide to Resonant Disorders. Today we want to talk about something that affects the way many people sound when they speak, and that is resonant disorders. Have you ever heard someone who sounds very nasal when they talk? Or maybe someone whose voice sounds blocked, like they always have stuffy nose? Those are examples of resonance disorders, conditions where the balance of sound between the mouth and the nose is not working the way it should. These disorders can affect children and adults, and they have a real impact on how clearly a person communicates and how they feel about their own voice. So today we're going to walk through the types, the signs, the causes, how we assess them, and how we treat them, all from the perspective of a speech-language pathologist. Let's get started. Section 1. Types and Overview. Our mind map presents 4 main types of resonance disorders. The first is hypernasality, when too much air flows through the nose during speech, producing an excessive nasal sound, especially on vowels. The second is hyponasality, the opposite situation, where nasal resonance is reduced, giving the voice a stuffy, congested quality. Third, cul-de-sac resonance, sound becomes trapped inside a cavity, resulting in a muffled effect. And fourth, mixed patterns, a combination of both, hypernasality and hyponasality, which makes clinical diagnosis more complex. Section 2. Key signs. How do we recognize these disorders? There are several important signs to look for. We may observe hypernasality on high vowels, particularly I and U, as well as audible nasal air emission during pressure consonants like P, V, or S. Other signs include reduced speech intelligibility, increased listener effort, and a atypical voice quality that may sound nasal, muffled, or hollow. One of the most critical signs is velopharyngeal dysfunction, or VPD, which refers to inadequate closure of the velopharyngeal mechanism during speech. This is a central concept in understanding resonance disorders. Section 3. Root causes. What causes these disorders? The mind map identifies 3 main categories. The first is structural issues, such as a cleft palate, oral fistulas, or a short velum that physically prevent proper velopharyngeal closure. The second is obstruction, for example, enlarged adenoids or nasal blockage, which typically result in hyponasality. And the third is neurological factors, when impaired muscle control or coordination affects the movement of the velopharyngeal structures. Now, I'll pass the presentation to my partner, Maria Lopez, who will walk us through the assessment tools, treatment options, the SLP's role, and our final conclusions.
Thank you, Alejandra. My name is Maria Lopez, and I will continue from here. Once we have identified the signs, the next step is assessment. Our mind map outlines 4 key evaluation approaches. First, a detailed speech sample analysis. Examine how the patient produced vowels and consonants in connect speech. Second, an oral mechanism examination, that is observing both the structure and the movement of the articulators and velopharyngeal mechanisms. Third, a multilingual screening. Especially important is in diverse population where the clinician considers the patient linguist and cultural background. And four, instrumental evaluation, including tools like nasometry and nasoendoscopy, which provide objective, measurable data about nasal airflow and velopharyngeal function. Once assessment is complete, we move to treatment. There are four main pathways. The number one is surgical intervention. Procedures such as pharyngeal, flap, sphinctered pharyngoplasty is often recommended for a structured VPD. Prosthetic devices like a speech bulb or palatal lift offer physical support when surgery is not indicated. Pharmacology or medical management address underlying causes such as reducing adenal size or treating nasal obstruction. And finally, behavior speech therapy target exercises designed to improve resonance, balance, and articulations, where the speech language pathology takes a direct and active role. And brings us to our role as speech language pathology, which involves three core responsibilities. First, assessment and diagnosis, conducting and comprehensive evaluation to identify the type and severity of the disorders. Second, individualized treatment planning, designing evidence-based intervention tailored to each patient's specific needs and profile. And third, family and team collaboration, working alongside ENT specialists, audiologists, dentists, and primary care providers, while ensuring family understand the process and feel equipped to support their loved ones at home. And to close our presentation, highlights for essential clinical recommendation. Once early screening and comprehensive assessment, the earlier we identify resonance disorders, especially in children, the better the outcomes. Connected speech tasks are key to documenting real function impact. 2. Interdisciplinary collaboration. Coordination care with ENT, audiology, dentistry, and primary care leads to more complete and effective management. 3. Differential diagnosis. It is a critical and distinguish whether BPD has a structural, neuromotor, or behavior origin, because each requires a fundamentally different approach. And 4, family education and support. When family understand what is happening and why, they become true partners in the therapeutic process. We hope this presentation has given you a clear and useful overview of resonance disorder from types and cause to assessment, treatment, and clinical best practice. Thank you so much for watching. That's been Maria Alejandra and Maria Lopez from UDELA, English Module 2026.